Good. So the note man, yes? If we take all the wind will blow all the notes, but we're trying to do before getting to see all more the anatomical name. And really, it's quite confusing because in anatomy there are two sets of names. There is the common name, like the skull, and then the anatomical name that will be more like cranium. Yeah? So let's start from the head, okay? So actually this one I'll keep. There should be here a skull. There is a skull? Cranium. Good. So the cranium is the skull bone, yeah? And that's a general name for all the bones that covers the brain. Yeah? Then we'll go into the jaw. There is another name for the jaw, mandible. Good. So here is a good example. I'll keep this one here. For two names, the jaw, which is the common name, and then the mandible, which is more the anatomical name. Now, it's not in English. Those who don't speak English, it's in Latin. A lot of the names. So everybody needs to learn those.
You wrote Man Bible.
Yeah.
Yes. Oh, good. Man Bible. Okay. Let's go further down. Again, the collarbone, yeah, which is the bone that you feel here in front, would be called the clavicle. Yeah. Yeah. Then, chest bone would be called sternum. Good. Now, some of these names would go into more common language, like sternum. You can use sternum, but if you put the scapula, people may not know. Okay. Then, what do we have here? We have the ribs. How many pairs of ribs do we have? 12. Is it?
Women have different.
Is it? Yes. Is it? Women have different.
Women have an extra pair. Don't they?
No.
Extra one, I think.
It's in the Bible, but not in anatomy. Not in anatomy. No. But the funny thing is that 0.5% of population would have extra rib.
One.
Yeah. 2. So 0.5% of all people. So if going to have a room with 200 people, then statistically one should have 2 extra ribs, usually on the neck. But it might be okay. No, they may not be noticed. Okay. So we're going now on to the shoulder. So shoulder blade. And the anatomical name is scapula. Good. Good. Now we're doing the spine. So the neck, how do we call the neck in anatomy? Cervical. Cervical area. And the top 2 cervical joint or bones are the atlas and the axis. The atlas and the axis. You have a question about the homework here, so hey, remember that? Yeah?
Which one is higher up or which one?
The atlas.
The atlas.
The atlas is the higher one up. Okay? So if this is the neck, how do we call the upper back? Thoracic. Good. Thoracic spine. And how do we call the lower back? Lumbar. Good. And here you have vertebrae. Yes, like all over the spine. And then the sacrum. Yeah. And then the coccyx, which is remnant of the tailbone. Good. And floating rib. Yeah, they're just floating. You see that they are actually not attaching to anything. Yeah. As opposed to the rest of the stern, or the rest of the ribs, where would they attach in front? The ribs, sternum. Yeah. And onto the back, they will attach to the spine. Yeah. Good. So they're creating a nice cage around. So, you know, we have security on the vital organs like the heart and the lungs. Okay, good. Now let's do the arm. Yeah. So in anatomy, this area called the arm, and this area called the forearm. Yeah. There is no like upper arm or lower arm, but arm, forearm, and then wrist, hand, and fingers. So the arm is the humerus, and the forearms are the ulnar and the radius. Yeah, ulnar and radius. We'll know which one belongs to which one. Then after that, we have the wrist bones that are around here. Believe it or not, in this small area have 8 bones, quite small. Yes, they call the carpal. Do you see them here? Very small bones. Yeah, so they give you a nice attachment, nice movement for your hands to move. And then if you have the carpal, which are the wrists, you have the metacarpal and phalanges, which are the fingers. Okay, going to the hip. Yeah? Oh, we have here, sorry, we have the spinal disc. You see the clear color between the vertebrae? The disc gives the spine its shock absorption. So if you jump, it all not got into your head. Only drink does. Okay, so this bone in generally called the hip bone. There is anywhere?
Yeah.
Yes, here, the hip bone. Good. But actually it has it's made up of 3 regions. The ilium, can you feel the ilium? Yes, on the waist. Yeah. And now the ischium, or the sit bone, is when you're sitting. If you put your hand under when you're sitting, you feel those. Yeah. And then the front is the pubis area. Yeah. It has another name, innominate bone. Never mind. Yeah, we're getting clear, isn't it? Femur on the thigh. This area called the thigh, the femur. Yeah. Actually, is the longest bone in the body. Yeah, from here to here. Yeah. And then the patella, which is a funny bone, because later on we'll see it has very interesting feature. It's one of the bones that grow in the muscle. So, or it's called the kneecap. And then getting there into the leg. So this is the thigh, and that's the leg, fibula and tibia. And then, like the carpal and like the carpals, you have the tarsal bones, which are short, small bones, and then phalanges and metatarsals, and on the back, the heel bone. So how many bones we have altogether in the body?
206.
206. But no, there are not 206 names, because, for example, the ribs are 12 times 2 sides, 24. So actually it would get quite easy for you to remember it, and then on top of it we build muscles, and then on top of it we'll build the nervous system. So by the end of the course you would be familiar with the anatomy that you need to know. Yeah, you're not going to learn really high level anatomy, but what I want you to know is good solid level and understanding about what you need to do. So when it comes to massage and understanding the effect of the massage, you would know how it is. Okay? Great.